Hey everyone, so today we're going to talk about antibiotics for infectious diseases. So let's start off. What are antibiotics? Well, antibiotics can also be called antimicrobial drugs, and they treat disease that is produced by bacteria specifically. So these aren't for viruses, these aren't for fungal infections, they are for bacteria. Bacteriostatic antibiotics inhibit bacterial growth in the body. So there's two different types of these antibiotics. The bacteriostatic ones inhibit the growth of bacteria in the body. So they don't actively kill the bacteria, they just stop it from multiplying. Bactericidal antibiotics actively kill bacteria in the body. So that is the difference. As we go through this presentation, you'll see some antibiotics are bacteriostatic versus bactericidal. Now, antibiotics are extremely varied in their different side effects, and there's a lot of nuance in the different categories of antibiotics as to what they can do. However, you can pretty much always guarantee there's going to be certain side effects that every antibiotic has. So the important thing to remember about antibiotics is that just about all of them cause nausea, vomiting, and diarrhea as a side effect. It's important to recall side effects don't happen in everyone, but they maybe happen between 10 and 15% of the population who takes the drug. So say 1 in 10 or 2 in 10 that take an antibiotic might experience some type of nausea, vomiting, or diarrhea, often abbreviated as NVD. Now, skin sensitivity is also common with antibiotics as a side effect. Now, skin sensitivity can range, right? So it can be anything from rashes to hives to flushing of the skin, that is to a redness of the skin, almost like a rosacea or an allergic reaction to an antibiotic, which is not entirely uncommon for most classes of antibiotic. The skin sensitivity might also include what's called photosensitivity. Photosensitivity being that someone will burn much more easily if they're not wearing sunscreen outside. Now, antibiotics are also known for causing multiple drug interactions and interacting with other drugs. And you may need to take with or without food depending on the antibiotic. So that's usually depending on how the antibiotic is released within the body, whether it's an IV or if it's taken orally by mouth, and then how the antibiotic is metabolized in the body, because certain foods can interfere with how those antibiotics work. So let's start with our beta-lactams. You can see they're called beta-lactam antibiotics. Greek letter beta is up there, so you might see it written like that as well. But they are bactericidal antibiotics, which disrupt the synthesis of bacterial cell walls. Bactericidal, you'll recall, that means they kill the bacteria. It's really cool, actually, this mechanism of action, how they work. Not to get too technical for you guys, but I think it helps sort of understand how the antibiotics working in the body. So in a bacterial cell, you have this very, very strong like capsule and cell wall, and the inner juices of this cell, the inner what we call the cytoplasm, where all of the information that the bacteria has, all of its little organelles that it needs for replicating and for surviving, they're all really packed in to this cytoplasmic space. So in order to maintain this high pressure environment within the cytoplasm of that bacterial cell, it needs a very, very strong and well put together cell wall. The cell wall is made out of protein. The cell wall and capsule is made out of protein. So everything holding that in is just a protein. And what the beta-lactams do is they make the bacterial proteins unstable in those cells, and they essentially break them apart until they explode. So it's sort of like if you were to open something like that had been packed in a very, very tight box, say like, you know, like the candy for children type prank type things, little can, and then you open it up and the thing like springs out and surprises you. It's good for like pranks and stuff. That's kind of like what happens with beta-lactams and the bacterial cell anatomy, right? So they open the jar, they find a way, that antibiotic finds a way to get into that cell membrane, disrupts it, messes it up, and then it can't hold that pressure anymore, and it pops open just like a Jack in a Box, or like those little candy for children pranks. So super cool that basically these antibiotics explode the bacteria. Anyway, this is one of the largest categories of antibiotics. And there's lots and lots of drugs that are not mentioned here, but I tried to tailor this presentation to the top 200, 250 drugs that you guys are most likely going to need to know for the exam. So we have our penicillin antibiotics, which fall under the beta-lactam family. Those are amoxicillin, which is amoxil, and amoxicillin plus clavulanate, which is otherwise known as Augmentin. Two very, very common medications. Now, we also have cephalosporins, which are a different category of beta-lactam antibiotics, but they're still related to penicillins. You can tell that it's a cephalosporin. They always start with the prefix ceph, whether it's CEPH or CEF. So they all start with ceph. Cephalexin or Keflex, cefuroxime or Ceftin, cefdinir or Omnicef. So you can pretty much always tell if it's a cephalosporin antibiotic because they all start with that same prefix of ceph. Now, beta-lactam antibiotics are very, very common for sinus and upper respiratory infections. If you're like me and you get one just about every year, I have been on Augmentin more times than most. Amoxicillin or Amoxil, it's available as a capsule, tablet, chewable tablet, liquid or pediatric drop. These are probably the things you are going to reconstitute the most in a pharmacy, especially if you're working in a community pharmacy. You mix up the powder for the suspension with an adequate amount of water to create that combination. And you just want to make sure that the child, it's refrigerated and given to the child accurately. But it's super common for kids, sometimes for adults too. And again, Augmentin is also in that reconstitutable liquid suspension, tablet or chewable tablet. A lot of times the suspension is easier, especially for kids, because those Augmentin tablets are like horse pills. Like they're pretty large and can be difficult to swallow even for adults. Side effects, of course, you're going to avoid these if there's a penicillin allergy. No ambiguity there. You do want to avoid them. But as always, nausea, vomiting, and diarrhea, and then rash is also a possibility. Continuing with our beta-lactams, we move on to the cephalosporins, and those are derivatives of penicillin antibiotics. So they're related. They're kind of like cousins to the penicillin family. Now, because of this, prescribers are super careful when prescribing these drugs to people with penicillin allergies. But a lot of times they can be prescribed depending on their chemical structure, because only about 5% chance of having what's called a cross-reactivity. So these cousins are distantly enough removed from penicillins that you can pretty much safely prescribe cephalosporins as long as you're monitoring someone with a penicillin allergy. Still important to know, but it's not necessarily a complete contraindication. It's not a complete no, you cannot use these. It's still possible to, especially if it's the best therapy for whatever infection they might have. Now, we can easily determine their category, as I said, because all the names start with Ceph or Ceph, either spelled CEPH or CEF. And many are used in both hospital and community settings to treat infections. So injections are available for some of these antibiotics. They're especially common in hospitals. You can get these IV. As I said, we already went through our examples, but the side effects are the same as other beta-lactams, with the added problem with injection site reaction, which again is very common with just intravenous drugs in general. So you might get a rash or redness right around where in the arm where they put the IV in. And that can happen if it's an IV or at an injection site. Next, we move on to our fluoroquinolones. They are bactericidal antibiotics that damage the DNA of bacteria. So instead of exploding the cell like the penicillins and the cephalosporins do, these guys just get into the bacterial cell and mess up the DNA. So they're often used to treat skin infections, especially in a hospital setting. They're used to treat methicillin-resistant Staphylococcus aureus or MRSA, or respiratory infections. So like staph infections, respiratory infections. These are very, very versatile antibiotics. There are some important considerations, though, that set these guys apart. You have to avoid dairy products, vitamins, or antacids within 2 hours of taking quinolone antibiotics. All of those have ions in them, like calcium and potassium and other vitamins, which actually bind to the antibiotic and stop it from doing its job in the body. So you're not going to digest and adequately metabolize and spread the antibiotic throughout the body if, say, you took it with like a tall glass of milk. That's not going to work because the milk is going to bind to the antibiotic. It won't get absorbed. It won't have an effect. There's a risk, especially in the elderly too, with fluoroquinolones of a tendon inflammation or rupture. This is a very unusual side effect, but it is important to let patients know that it is a possibility that they may have issues, especially if they have a history of tendon rupture. I would probably avoid fluoroquinolone antibiotics in those patients, just because even if it's a less than 1% chance of it happening, it still can happen. And it's a very debilitating injury if it does. We also have to avoid these in children due to muscle toxicity. So no fluoroquinolones for kids. They all end in floxacin. So you can remember these by the ending floxacin. So ciprofloxacin or Cipro, again, very, very, very common in hospitals. Levofloxacin or Levaquin, and moxifloxacin or Avelox. Now, common side effects, as I said, beyond the tendon rupture, which is not common but important to remember, you have your nausea, vomiting, dizziness, headache, also a possibility of insomnia or rash. Again, when they're IV, we get those injection site reactions as well. Cipro, again, as I said, super common in hospitals, comes in a lot of different dosage forms as well, so it's very useful. Levofloxacin as well, you can see the dosage forms right there, tablet or injection. Moxifloxacin is also found in eye drops, so that sort of sets it apart from the other fluoroquinolones. And the important thing with moxifloxacin is it's a QT prolonging drug. So you have to use caution in patients with heart conditions. There's this thing called the QT interval, which is, if you want to look at the arrhythmias lecture, which I'm going to get to posting, I'll have more information on that. Basically, your QT interval is how a measure of how your heart is supposed to be beating. Now, your heart should be beating in a regular QT interval, meaning the waves should go up at a certain point, and each of these points has a letter assigned to them, and those letters determine if your heart is beating regularly or irregularly. If it is prolonged, then that puts you at risk for potential dangerous heart conditions like a heart attack or high blood pressure, other issues. So you have to be cautious, especially in patients with heart conditions, when prescribing moxifloxacin. Next, we move on to our macrolides. They are bacteriostatic, so they prevent the bacteria from making proteins. They don't kill the bacteria, but they stop any bacteria in the body from replicating because they are bacteriostatic. They stop them, they put them in stasis. They stop them from making proteins or protein synthesis, and that stops the bacterial growth. Don't worry about this is just the ribosome. It's a little organelle that exists within the within the bacteria. The macrolide antibiotics work on there to stop them from growing. Now, they treat a wide range of especially respiratory infections. So like all of the macrolides treat pneumonia, as well as sexually acquired infections and gastrointestinal infections as well. So we have a few side effects and considerations. You cannot use clarithromycin or erythromycin with certain cholesterol drugs because that puts people at risk for muscle toxicity, especially so these would be like statins and other medications like that. There's also a possibility, as with everything, of gastrointestinal upsets or nausea, vomiting, diarrhea. Macrolides also have a small risk of what's called ototoxicity, which is toxicity within the ear. So that can cause hearing or balance problems, especially at very high doses. So you have to watch out for that, in addition to a potential for skin rash. Now, all of our macrolide antibiotics also end in mycin, which is a good way to remember them. So here are our examples. We have clarithromycin or Biaxin. It has many serious drug interactions. This was stressed in your pharmacy technician book, so I want to make sure to talk about those. Also, very important, if you're working with a clarithromycin suspension, do not refrigerate it. I repeat, do not refrigerate. If you refrigerate it, it will not work. And it won't work when it's unrefrigerated either. You have to use it right away. Clindamycin or Cleocin. It's often used for skin or acne, as well as vaginal infections. There are even like clindamycin wipes that you can use for acne, which are very, very common, especially if other medications for acne and just washing your face doesn't work. Clindamycin, since it's used on the skin, it's also known for it causing photosensitivity. So especially in summer months when people are working outside, you might want to avoid sun exposure, at least limit sun exposure. Make sure to advise those patients to wear their sunscreen before going outside. Now, azithromycin is another macrolide known as Zithromax or Z-Pak. You can see the Z-Pak right there. Full course of antibiotic therapy in just 5 doses. It comes in a very easy to use package, which has directions for the patient. And it's always 500 milligrams by mouth on day 1. And so you take 2 pills on day 1, and then you have 250 milligrams or 1 pill on days 2 through 5. It's also an oral suspension, so it's very, very good for pediatric use. And it's really versatile. It treats a whole lot of things. Z-Paks are prescribed for COPD or chronic obstructive pulmonary disease exacerbations. So that means if your COPD is acting up, you might get azithromycin, or COP-related pneumonia and other breathing difficulties, respiratory infections, as long as they're bacterial. It's used to treat chlamydia and gonorrhea. I remember when we were first learning about these sexually transmitted diseases, chlamydia and gonorrhea, and how we treat them. My professor always called it a Z-bomb because you give like 1 very, very large dose of azithromycin. And it's a sort of like you're dropping the atomic bomb on that STI, that sexually transmitted disease. So you give it the Z-bomb, it goes away. In a perfect world, it goes away. Most of the time it does. Sometimes we need something that's a little more stronger. Anyway, it's also really useful, and you'll see it occasionally prescribed for opportunistic infections. So this would be for patients who might have immune disorders like HIV/AIDS or other problems with their immune system, or maybe they're on immunosuppressant therapy. They might have lupus, they might have other immune disorders, or maybe they're transplant patients and they need to suppress their immune system. So we give them the azithromycin chronically, maybe 3 times a week, just to make sure that no nasty bacteria get into their system that they otherwise wouldn't be able to fight off. Also, it's used for traveler's diarrhea and a number of tropical diseases, which you might pick up if you drink the water in Mexico or other places where you might not have the best of drinking water, or you might not be acclimated to that type of food. Lastly, we have erythromycin, otherwise known as Aritab or erythrocin, and those are for infections. And again, it's an acne treatment that's often used topically. So we have these other agents, and I apologize right away for that awful picture of teeth, but you'll see why I put it there. We have doxycycline, which is also known as vibramycin, doxy, monodox, and a few other names. It's what's called a tetracycline antibiotic. It's bacteriostatic, so it doesn't kill the bacteria, but it stops it from growing. And it prevents bacterial proteins from forming again. Doxycycline and tetracycline antibiotics in general sort of treat all the weird diseases, like kind of a mixed bag of everything that's not treated well by other antibiotics. So it treats tick-borne diseases like Lyme disease, atypical pneumonias, so pneumonias that aren't necessarily found in the community, but maybe they're hospital acquired. So you get them while you're in the hospital. They treat a large variety of sexually transmitted illnesses, STIs. Tetracyclines are even used for anthrax. So like in a biological weapons attack, you would treat it with doxycycline. Important things with doxycycline: you limit sun exposure. Very, very important. It should not be used during pregnancy. It is potentially teratogenic, meaning it can cause birth defects and or harm the baby. So you cannot use it in pregnant women. And you should always ask a woman of childbearing age if they're pregnant or planning to become pregnant before prescribing a tetracycline or a doxycycline. And it should also not be used in children younger than 8 years old because it discolors bones, which include teeth. So that's what you see right there. That's discoloration caused by doxycycline. And that can be quite devastating, especially for kids whose first grown-up teeth are growing in and they're immediately discolored rather. So you don't use it in kids that are younger than 8 years old because you don't want them to have yellow smiles. Next, we have linezolid or Zyvox. It's a bacteriostatic antibiotic that interferes with protein synthesis. Again, I think you're seeing the trend at this point, right? Causes many drug interactions, especially with psychiatric and adrenergic drugs, so drugs that affect adrenaline and adrenaline release in the body. So often careful with people who might have psychiatric disorders or similar psych meds that they're on. The other very important thing with linezolid, it might cause a decrease in platelets, hemoglobin, which is the oxygenating part of your red blood cells, or in white blood cells. So a lot of times they need blood tests when taking linezolid. This is most often prescribed in a hospital setting as well. And then we have nitrofurantoin, macrobid or macrodantin. It's a bactericidal antibiotic, so it kills the bacteria, and it's used to treat or prevent urinary infections. So important counseling with nitrofurantoin. Again, a super common urinary infections are very, very commonly seen throughout both hospital and community settings. But nitrofurantoin is important. It's important to tell the patient that it might turn their urine kind of a funky color. It can cause urine to turn dark yellow or brownish. So just advise the patient that, hey, like this might not be, just be on the lookout for this. If you notice that your pee has turned orange, like this is normal. It's fine. It's a side effect of the nitrofurantoin. It'll go away when you stop taking the antibiotic. You have to have caution with patients with kidney disease as well, because it's filtered through the kidneys in order to work. Now we have some more other agents. We have metronidazole or metronidazole, otherwise known as Flagyl. Now, if there's any important counseling point that you remember with metronidazole, it's that you never drink alcohol while taking Flagyl. Never. So it has to be avoided even until 72 hours after the last dose of Flagyl. Your book says 1 day. That book is wrong. It's 72 hours, because why am I so adamant that it's 72 hours? It's because what happens is metronidazole creates what's called a disulfiram reaction within the body. So basically, if you drink alcohol and you take your metronidazole for whatever infection you have, vaginal, gastrointestinal, skin infection, firstly, you shouldn't be drinking alcohol if you're taking metronidazole anyway, or any antibiotic if you're sick enough to have to take an antibiotic. But if you do, you will instantly have the worst hangover symptoms of your life. You will not feel any of the effects of alcohol, and you will immediately be the sickest you've been in your life, vomiting, flatulating, going to the bathroom, worst feeling ever, worst hangover-like symptoms of your life, because the metronidazole interacts with the alcohol and causes some very, very nasty side effects. So never drink alcohol while taking metronidazole. We also have sulfamethoxazole and trimethoprim. That's a combo antibiotic, otherwise known as Bactrim. It's a sulfonamide or sulfa antibiotic, so you cannot use it in patients with sulfa allergies. Sulfa allergies are very, very common, so be careful. It's a combo medication with 2 antibiotics used to treat a variety of skin infections. So that's skin, GI, ear infections, also for urinary tract infections as well. So it's an alternative to nitrofurantoin, as well as pneumonias. Patients taking sulfa drugs also need to drink plenty of water because they can dehydrate them. And it also requires that hydration in order to work well in the body. It can also be hard on the kidneys, so you want to drink water for that as well. And then we also have vancomycin or vancomycin. You'll see it very, very commonly in hospitals. All the pharmacists are verifying those vanco troughs all the time. They have to monitor the peaks and troughs of the vancomycin concentrations in people's bodies. It is a glycopeptide antibiotic, usually used for serious infections and that are not easily treated by other antibiotics. So this is usually the antibiotic that's used if a person is hospitalized and they were previously treated outpatient and they're just not getting better from the infection. So it's used intravenously for systemic use, and it can cause what you see down there, which is caused red man syndrome, which is this very bad full body rash especially if it is given to someone too quickly. So it's very important when you're dosing vancomycin to administer it slowly through the IV to avoid red man syndrome. And that's pretty much the end of the antibiotic presentation. I should just touch on another very common counseling point that I just realized I forgot to put in. We always advise our patients to always finish taking their entire course of antibiotics. Why do I say that? It's because their whole course of antibiotics is necessary to completely kill all of the bacteria and prevent what's called bacterial resistance or antibiotic resistance. You may have heard of superbugs like MRSA, for instance, which are resistant to antibiotic treatment. This is because the bacteria, since they adapt and multiply so quickly, they can adapt to the antibiotic and learn to live with the antibiotic so the antibiotic can't affect it anymore. We want to make sure that those bacteria are killed the first time around so they don't have the opportunity to adapt and cause antibiotic resistance and potentially make it so these patients have to be hospitalized, that they have worse infections and potentially very, very bad outcomes. So we always want to make sure to tell the patient to finish your entire course of antibiotics, even if you feel better. Well, thank you very much, everyone. And of course, if you have any questions, feel free to email me.